February is Heart Month, and health experts say heart disease is different for women than men. Most women aren't even aware they have any underlying issues that could lead to cardiac arrest or heart attack. Alina Lee has more.
Cardiovascular disease is a leading cause of death for both women and men, according to health experts. But the causes and symptoms for women can often be much different than for men.
It does seem to track with menopause. There may be some hormonal changes that occur, and that may be part of what's going on. But unfortunately, we don't have a definite answer for why this is happening.
Experts say typical symptoms of a heart attack or cardiac arrest, like chest pressure and tightness, are not always felt by women.
Symptoms can be generic as shortness of breath, people developing a harder time breathing, doing something that normally would not cause any issues, like climbing a flight of stairs. Sometimes it's more kind of a sense of fatigue and malaise. It could be more kind of a heartburn type of thing, indigestion.
Women tend to overlook the pains that they're feeling. Women, if there's pain on their side or their back, it's something that they don't want to pay close attention to because of all the life things that are happening throughout the day-to-day. Being a mom, going to work, making sure that you're wearing all the hats that you're wearing.
According to the American Heart Association, there are over 1,100 cardiac arrest cases in Hawaii. 90% of patients don't make it because of a delayed CPR response. For women, this can be a bigger problem.
What we found is that women are less likely to receive bystander hands-only CPR because community members are afraid to touch women possibly inappropriately, break a rib. But there are Good Samaritan laws that we have here in Hawaii, making sure you are able to do this.
And it's not just stress, poor diet, and lack of sleep contributing to increased risk for heart disease.
Over 40% of women over the age of 20 don't even realize that they have underlying cardiovascular issues. Someone could experience a heart attack and they can be the healthiest person, but they hadn't realized that they had an underlying cardiovascular defect that they didn't know about.
Women are asked to take ownership and prioritize their health.
We're encouraging our women to put themselves first and to take care of themselves first before anyone else.
Women aren't the same as men, and they don't feel the same thing as men. We want to lead a healthy lifestyle, eat healthy, and prevent this from happening in the first place. I mean, it's always better to prevent a problem than to have to deal with it afterwards.
Alina Lee, KHON2 News, working for Hawaii.